Your medicine cabinet won't cut it in a real emergency. The grid fails, pharmacies close, hospitals prioritize only the worst cases. You've got about 3 days of supplies at home, emergencies last weeks. We're building a medical kit for complete autonomy. No doctors, no services. Just you and what you've stocked. I'll show you what to get, why, and how to use it safely. Start with what kills fastest, blood loss. You have 3 to 5 minutes of consciousness after a major artery is cut. Lose 30 for 40 of your blood, about 1.3 gallons total, and you're in severe shock, confusion, rapid heart rate, dropping pressure. Over 40, organs fail without surgery and transfusion. If you're older or have heart issues, it hits faster. What stops it without help? Real medical tools. First, the CAT tourniquet. This windlass system lets you apply it one-handed, even alone with a femoral artery blade. Twist to occlude the vessel, simple engineering. Stock 2. Genuine ones from North American Rescue work reliably, but counterfeits fail. Redundancy covers that. For massive thigh trauma or larger builds, stack a second higher up the leg for full compression and arterial stoppage. Critical step everyone forgets. After applying the tourniquet, check for distal pulse. Feel for a pulse in the foot for leg injuries, or at the wrist for arm injuries. No pulse means arterial flow is stopped. If you feel a pulse, tighten it. Otherwise, you're just blocking venous return, worsening the bleed. Tourniquets hurt intensely because they crush tissue and fight arterial pressure. If it doesn't hurt, it's not tight enough. Once on, do not remove or loosen it. Loosening can restart bleeding on swollen tissues, flood the bloodstream with metabolic waste like potassium and lactic acid, or release clots causing embolisms. Keep it on until professionals take over. That's the stop the bleed protocol for civilians. Next, hemostatic gauze like QuikClot or Celox accelerates clotting for wounds where tourniquets won't work: groin, armpit, and other junctional areas. Neck wounds are different. The carotid, jugular, vagus nerve, and trachea are all close together. For civilians, apply direct finger pressure on the exact bleeding point. No packing or wrapping. Packing risks compressing carotids to cause stroke, stimulating the vagus to stop the heart, or blocking the airway. Hold pressure until help arrives. For groin and armpit wounds, pack hemostatically. Stuff gauze deep into the cavity for compression against bone. Limbs, groin, and armpits only. Never chest or abdomen, as that pushes gauze into organs. Pack hard and maintain pressure. Surface pressure on deep wounds won't stop the bleed. Stock at least 3 packages, one for training, to practice on a wound simulator or raw meat before a real emergency. 2 for actual use, since the first will likely get wasted. That's from after-action reports. You stopped the bleeding. You've bought time. In a hospital, that's for professional care. Without it, in a basement with no power or water, it's time for infection to start. Every penetrating wound is contaminated from the knife, glass, skin, or air. Bacteria establish colonies quickly, leading to cellulitis, abscess, or sepsis if unchecked. Sepsis spreads infection system-wide, crashing blood pressure and organs. The protocol: irrigation, disinfection, coverage. Do them right, sequentially, or infection gains ground. Irrigation first. Use volume, pressure, and the right fluid. Skip hydrogen peroxide. It damages tissue. Avoid chlorhexidine in deep wounds. It's toxic to healing cells. Opt for sterile saline or clean drinking water. Saline is best. Tap water works when infrastructure holds, but in collapse, with plants offline, it may carry bacteria like Pseudomonas, turning wounds worse. For failure prep, stock sterile saline or a filtration system for medical-grade water. Pressure: 4 to 15 psi to flush bacteria and debris without harm. A bottle with a hole in the cap gives under 4 psi. Ineffective, just spreads contamination. A large syringe with 18-gauge needle exceeds 20 psi, damages the wound. Use an irrigation cap for bottles or a 35 milliliter syringe with 19-gauge catheter tip for 8 to 12 psi. Volume 1 to 3 liters for contaminated wounds per hospital standards. Not a quick rinse. Full mechanical removal of debris with sterile saline or clean water under pressure. Stock liters of saline or reliable filtration. Then, disinfect wound margins with povidone iodine solution. It's iodine with povidone for gentler action on intact skin around the injury. Don't use inside. It causes cellular damage where healing is needed. Margins block bacterial invasion. 70% isopropyl alcohol is for instruments and intact skin only. Inside a wound, it causes chemical burns, worsening injury. Use it to sterilize scissors, tweezers, hands before touching. Triple antibiotic ointment, the combination of bacitracin, neomycin, and polymyxin. Apply it to minor cuts and scrapes after cleaning to prevent infection. It's not for serious injuries needing irrigation, but stock multiple tubes for everyday use. Dressings and bandages. People underestimate quantities. One trauma can use up a pharmacy's supplies. Change dressings daily or twice if drainage is heavy, each time with new sterile materials. A 2-week wound needs at least 14 changes, so that's 14 gauze pads, tape, and wrapping. Stock sterile gauze pads in multiple sizes, 4x4 inch standard, 2x2 for smaller wounds, in boxes. Sterile non-adherent pads like Telfa to cover without sticking. Roll gauze for wrapping. Medical tape. Paper for sensitive skin. Cloth for secure hold. Elastic bandages for compression. Triangular bandages for slings. Adhesive bandages, the regular Band-Aids, in quantity and variety packs. You'll use dozens for minor cuts and blisters. Advanced wound care. Hydrocolloid dressings for blisters and partial thickness burns. They create a moist healing environment and last days. Warning: never use on infected or necrotic wounds. These occlusive dressings seal the area, risking anaerobic bacterial growth and sepsis. Only for clean, non-infected injuries. Burn dressings, designed for thermal injuries. They don't stick, provide cooling, and avoid trauma on removal, unlike regular gauze. Pain and fever management. When medical help fails, uncontrolled pain or fever can kill. Ibuprofen, generic for Advil or Motrin. An NSAID that reduces pain, fever, and inflammation. OTC dose, 200 to 400 milligrams every 4 to 6 hours. Max 1200 milligrams daily without supervision. In collapse, prescription max is 3200 milligrams daily for serious cases. Warning for high doses assumes hydration, healthy kidneys, and supervision. In survival, dehydration from exertion, heat, or limited water risks acute kidney injury, failure in days, worse if over 45 or with kidney issues. For high-dose use, drink multiple liters of water daily. Monitor urine. If dark or low, stop immediately. Kidney failure can kill faster than the injury. For everyday lower doses, it's safe with hydration, but even 1200 milligrams risks stomach irritation or heart stress if older or with heart disease. Stock in bulk, at least 500 tablets. You'll go through them in prolonged scenarios. Acetaminophen, generic name for Tylenol, pure analgesic and antipyretic, pain relief and fever reduction, no anti-inflammatory effects. Advantage doesn't irritate the stomach like NSAIDs, works through different mechanisms, so alternate with ibuprofen for better control. Adult dose 325 to 650 milligrams every 4 to 6 hours. Max 4,000 milligrams daily. FDA limit. Exceed it. Risk liver damage. Overdose causes acute liver failure. Symptoms delayed. Stock it. Respect limits. For serious pain, injuries causing screams or blackout, OTC options insufficient. Work with doctor beforehand. If you have a physician who gets your preparedness, discuss prescriptions for stronger pain management. Can't give opioid dosing here, against policy and potentially illegal. But talk to your doctor about pain for trauma in scenarios without care. Get prescriptions if they agree. Follow their instructions. GI emergencies kill via dehydration and electrolyte imbalance. Diarrhea, vomiting. In grid down without IV, fatal in days, especially for kids and elderly. Loperamide, Imodium, slows intestinal motility to stop diarrhea. Dose, 4 mg initial, then 2 mg per loose stool. OTC limit 8 mg daily. Prescription max, 16 mg for severe cases. Overdosing causes fatal heart rhythm issues, prolongs QT interval, leading to arrhythmia like torsades de pointe. Risk higher if dehydrated, older, with heart issues, other meds, or electrolyte imbalance from diarrhea. In collapse with severe diarrhea, higher dose might be needed, but monitor for palpitations, dizziness, faintness, chest discomfort. Stop immediately if any. FDA black box warning for cardiac risk. Safer option, bismuth subsalicylate, Pepto-Bismol. Treats diarrhea, nausea, upset via different mechanisms. No cardiac risk. Avoid if aspirin allergic, contains salicylate. Turns stool black. Anti-nausea, meclizine, OTC as Dramamine or Bonine, for nausea, vomiting, motion sickness. Adult dose, 25 to 50 mg daily. Causes drowsiness, but breaks nausea cycle to allow hydration and meds. For unresponsive severe vomiting, discuss prescription anti-nausea with doctor in advance. Oral rehydration salts are not optional. Water alone is ineffective because you are losing electrolytes like sodium, potassium, and chloride needed for absorption. The World Health Organization formula uses specific glucose and sodium ratios to maximize uptake. Buy packets or make your own. The recipe: 1 quart clean water, 6 teaspoons of sugar, and 1/2 teaspoon of salt. Mix until dissolved. It keeps you alive. Stock commercial ORS packets in quantity. They're cheap and shelf-stable for years. Activated charcoal for poisonings. People mess this up by buying tablets. Useless. The therapeutic dose for an adult is 50 to 100 grams. Each tablet is typically 250 milligrams, a quarter of a gram. You'd need 200 to 400 tablets while poisoned and vomiting. Impossible. Get activated charcoal powder, mix into a slurry, and drink. It binds toxins in the stomach and prevents absorption. It doesn't work for alcohol, heavy metals like iron or lithium, or caustics like drain cleaner. Use for drug overdoses, certain plant poisonings. Give within 1 to 2 hours of ingestion. Stock powder, not tablets. Respiratory support. Breathing problems strike fast in collapse. For asthma and COPD, get prescription bronchodilator inhalers. They relax airway muscles and open passages during attacks. Work with your doctor for supply and backups. Follow dosing instructions. For everyone, smoke inhalation. In fires or poor air, airway spasm even without prior asthma. Bronchodilators relieve that, letting you breathe. They don't treat lung burns or heal tissue, just ease spasm while lungs recover. If prepping for fires or smoke exposure, discuss bronchodilators with your doctor, even without chronic issues. Antibiotics, most complex for prep. Bacterial infections like pneumonia, wounds, UTIs, abscesses are treatable but fatal without care. What I can say, I can't give dosing for prescription antibiotics. That breaks YouTube rules and maybe law. Can't recommend brands or match antibiotics to infections. What I can tell you is this: before any emergency, establish a relationship with a physician and have an honest conversation about preparedness. Explain that you want to be ready for scenarios where getting to a pharmacy or doctor isn't possible. Many doctors understand this and will work with you to prescribe appropriate antibiotics for your specific health history and risk factors. The classes of antibiotics most useful for common bacterial infections include penicillin type for respiratory, ear, some skin infections, and strep throat. Macrolides as an alternative if you're allergic to penicillin. Fluoroquinolones for more serious infections, though they carry an FDA warning for tendon rupture risk. Highest in those over 60, but possible for anyone. For preppers needing mobility, this makes them a last resort. And nitroimidazoles for anaerobic infections and certain parasites. Your doctor knows your medical history, allergies, current medications, and can prescribe the right options with proper instructions. Get those prescriptions legally, store them properly, rotate your stock. Understand this, antibiotics are not candy. Using the wrong one, too little, or stopping early breeds resistant bacteria. In a long-term crisis, creating resistant infections in your community could be worse than having none at all. Respect these medications. Use them only when needed and as prescribed. Chronic prescriptions and working with your doctor. This is the most important part for anyone serious about medical preparedness, because it's the only legal, safe, ethical way to obtain prescription medications. If you or family members depend on daily medications for chronic conditions like high blood pressure, diabetes, thyroid disorders, psychiatric conditions, asthma, or COPD, even a 2-week interruption can cause serious complications or death. The system provides 30-day supplies with no buffer, assuming pharmacies stay open, supply chains function, and insurance processes on time. That's not preparedness. But even without chronic conditions, certain prescription medications are valuable in emergencies: strong pain management, anti-nausea for severe vomiting, antibiotics for bacterial infections, antiparasitics, bronchodilators for asthma, epinephrine for severe allergies. All require prescriptions. The strategy is simple. Build a relationship with a primary care physician and be honest about your preparedness goals. Most doctors understand that having backup medications for emergencies is reasonable. Some won't be comfortable. Find one who will. For chronic medications, ask about 90-day prescriptions instead of 30-day. Many insurance plans allow this. Pick up 3 months worth, use 2, and before the third ends, fill the next. Now you have a 1-month buffer. Repeat to build a rolling stockpile. It's legal, ethical, and requires just communication with your doctor and pharmacy. For emergency prescription medications, the ones you don't take daily but want on hand for crises, explain your needs to your doctor. I want to prepare for times when I can't reach a pharmacy or doctor. Can we discuss appropriate prescriptions to stock? Some will prescribe antibiotics for travel, extra epinephrine auto-injectors for allergies, or pain options for trauma. Be specific: natural disasters, infrastructure failures, power outages. These are realistic. Doctors get it. Skip zombies or collapse talk. If your doctor won't prescribe, find one who will legally. Avoid sketchy sources, vet drugs, or DIY. That's risky and often illegal. For non-covered or controlled meds, aim for a 2-week buffer. It could bridge to stability. Document all: meds, dosages, doctors, expirations. Store with supplies. Keep a backup. Allergic reactions can kill fast in a crisis, with more exposures and less access to care. Diphenhydramine Benadryl is a first-generation antihistamine that blocks histamine, easing itching, hives, sneezing, runny nose. Adults, 25-50 milliliters every 4 to 6 hours as needed. It causes drowsiness, dry mouth, and can raise heart rate. Clear point: Benadryl isn't for rapid heartbeat or tachycardia. As an anticholinergic, it blocks signals that can speed your heart, worsening palpitations or masking a heart attack or arrhythmia. Potentially fatal. Use it only for allergies. Heart symptoms mean emergency. Don't medicate them away. Second-generation options like cetirizine, Zyrtec, or loratadine, Claritin, cause less drowsiness, suit daily management for seasonal allergies or hives. They act slower for acute reactions. Epinephrine autoinjector for anaphylaxis. Severe allergic reactions from bee stings, food, or drugs cause throat swelling and breathing issues. Without it, outcomes worsen quickly. If you or household members have severe allergies, get prescribed autoinjectors from your doctor. Follow your device's instructions. They differ by brand. For long-term prep, ask about extras. They cost a lot and expire in 12 to 18 months. Epinephrine breaks down in light or heat. Expired ones can still work if stored cool and dark. In anaphylaxis, use them if needed, better than nothing. Check the viewing window first. Solution must be clear and colorless. If pink, brown, cloudy, or with particles, discard. It's unsafe due to breakdown products. After injection, seek medical help right away. Epinephrine lasts minutes to hours, and reactions can return. Decongestants ease nasal congestion from colds or allergies. Oral ones with pseudoephedrine narrow blood vessels to shrink passages. They affect vessels body-wide, so avoid if you have high blood pressure, heart issues, or are over 65. Risk of spikes, stroke, or attack. Safer options: saline sprays to rinse passages, or steroid nasal sprays to cut inflammation without full body effects. They take longer, but suit high-risk groups. If healthy with normal pressure, oral types are okay in doses. Know your factors. Skin and parasite care. Minor issues grow in poor hygiene or exposure. Antifungal creams like clotrimazole or miconazole treat athlete's foot, jock itch, ringworm. They halt fungal spread. In humid or crowded spots, infections rise fast, causing pain and itch that weaken skin against bacteria. Keep several tubes. Hydrocortisone cream, 1%, handles general itching, minor rashes, insect bites, and contact dermatitis. It's a mild topical steroid that reduces inflammation and itching. Use it only on intact skin, not open wounds or infected areas. Permethrin treats clothing and gear against ticks, mosquitoes, and other insects. Spray it on fabrics, let it dry, and it stays effective through washes. Treated clothing helps prevent insect-borne diseases. Antiparasitic medications tackle parasitic infections like intestinal worms and scabies, which spread through contaminated water or contact in poor sanitation. These require prescription drugs. For long-term prep, talk to your doctor about options based on your region and risks. They're prescription only. I won't specify drugs or doses here. Essential non-expiring tools include a manual blood pressure cuff with stethoscope. Digital ones rely on batteries. Manuals last indefinitely if you learn them. It checks for shock, hypertension control, or crises. A pulse oximeter measures oxygen saturation. Clips on a finger, shows hemoglobin oxygen percentage. Normal is 95 to 100, below 90 signals respiratory issues. It uses AAA batteries, stock extras. Thermometer detects fever. Digital ones use long-lasting button batteries. For backup, get a gallon stand model, the safe, non-mercury alternative. Mercury versions are toxic and banned in most US states. Nitrile gloves in multiple pairs and sizes protect against blood-borne pathogens and contamination. Use them for wounds or fluids. They're disposable, so stock boxes. Blunt-tip medical scissors cut clothing from wounds without skin punctures. Fine-point tweezers remove splinters, glass, ticks, or debris. For injectables, stock disposable syringes and needles. 3 milliliter syringes standard. 21 to 23 gauge for intramuscular use. Medication without training is just expensive inventory. Train before you need these skills under stress. Apply a tourniquet on yourself and others. Practice until it's muscle memory. Under stress, use gross motor patterns. Pack a wound with hemostatic gauze. Practice on a wound simulator or raw meat. Understand the pressure and technique. Give an intramuscular injection. Practice on an orange or chicken breast. Use proper angle, depth, and aspiration to avoid blood vessels. Recognize infection signs: increased redness, swelling, heat, purulent discharge, red streaking indicating lymphangitis, fever. Escalate to antibiotics when these appear. Recognize dehydration, decreased urination, dark urine, dry mucous membranes, skin tenting, altered mental status. Switch to emergency measures when oral rehydration fails. Training requires honest practice and learning. Use online resources, wilderness, or tactical medicine courses. Invest time now. You've assembled your medical stockpile, worth hundreds or thousands. Now maintain it to prevent degradation. Inventory check every 6 months, inspect supplies, check expiration dates, rotate stock, first in, first out, like grocery stores. Store in cool, dark, dry conditions. Basements work if not damp. Climate-controlled closets are best. Avoid garages and attics with temperature swings. One last thing about batteries. If you're storing battery-powered medical equipment like thermometers, pulse oximeters, or blood pressure monitors, skip regular alkaline batteries for long-term storage. They leak and corrode. Use lithium batteries, like Energizer Ultimate Lithium. They have a 20-year shelf life, work in extreme temperatures, and don't leak. Yes, they're pricier, but so is replacing equipment damaged by corrosion. Organize your stockpile logically. Put bleeding control in one clearly labeled, immediately accessible container. Wound care in another. Group medications by category: pain management, gastrointestinal, antibiotics, chronic prescriptions. In an emergency, you don't want to dump out containers searching for what you need. Finally, keep documentation. Maintain a written inventory with expiration dates and locations. Store a copy with the kit and a backup elsewhere. If you're incapacitated, others need to know what's available and where. Bottom line, a functional emergency medical kit covers hemorrhage control, wound care, medications for pain and fever, infection management, gastrointestinal issues, respiratory support, antibiotics for bacterial infections, buffers for chronic prescriptions, allergy management, skin and parasite care, plus tools and training to use it all correctly. This becomes your medical setup when professional care fails. Here's the disclaimer. This is educational info for preparedness in scenarios without professional medical access. It's not medical advice, not a substitute for licensed providers, and not permission to self-diagnose or treat when care is available. Every medication carries risks, side effects, and interactions. Before stockpiling, consult your doctor or pharmacist about your health, current meds, and potential issues. In emergencies, call services if possible. Use this only if no intervention is the alternative. Even in collapse, if medical resources exist like clinics, traveling doctors, or aid volunteers, use them. Preparedness bridges to professional care, or provides basics when nothing else does. If this helps, consider subscribing. I cover real risks, not fantasies. Consult medical pros and local agencies for official protocols. Guidelines vary by area. This is general info, not specific to your location. Take care of yourselves and loved ones.